Our goal during this program, Your Active Life, is to educate and provide you with some valuable orthopedic information.
We'll be discussing in a series of programs the main orthopedic problems with the sports medicine, the problems with joints and bones, as well as in general the treatment of pain management.
Dr. Marquez, what is orthopedics?
Orthopedics is a subspecialty of the medicine in which we treat the most common problems, mostly related to arthritis, as well as with sports medicine, as well as the treatment of the pain in general.
We believe that this valuable information will help you make important decisions for you and your family, and ultimately enjoy an active life. Dr. Marquez had the opportunity to meet with some people from our community that asked him very interesting questions on common bone injuries. Let's take a look.
What is your question?
Doctor, I do a lot of exercises and I do a lot of weightlifting, but every time I lift weights, my shoulder seems to hurt, both of my shoulders. What seems to be the problem?
What you just mentioned is something that occurs very common in patients like you that are very active, that they like to lift weights, and also occurs this injury on the shoulder that you mentioned also occurs in patients who work out a lot at work. You're just pointing to an area of the shoulder that is very common to have pain, and that's what we call the acromioclavicular joint. The only thing it means is that you have pain between the clavicle, which is the collarbone, and the acromion. This is what we call the acromion, which is part of what everybody knows it as the shoulder blade. And that forms a little joint called the acromioclavicular joint. Usually, damage to the acromioclavicular joint occurs when you do a lot of lift a lot of weights, or you use your shoulder a lot. So again, this is an overuse syndrome. It's very common, but also it has a lot of ways that we can improve this. First of all, how we lift those things, how we do the exercise, modifying the activities. The other type of treatment that we have for these things is taking anti-inflammatory medication. Sometimes when it becomes chronic, we can even inject it. Most of the time with icing, modifying the activities, we will resolve the problem. But if it continues, I would recommend again to see your doctor or see an orthopedic surgeon, see how we can improve your problem.
What Joe is demonstrating here is the proper way to do a shoulder press exercise. Now, obviously, this is working out the shoulders, but the correct way to do it is take it slow, elbows always bent, and you're going to be lifting the weight over your head, just as Joe is doing right now.
Do you have a question for the doctor?
Yes, I do.
What is your question?
Dr. Marquez, about 4 years ago, I fell and I broke my ankle in 4 places. I had surgery, and supposedly they cut nerves that they weren't supposed to. And my foot is in pain all the time. I have this sickness that I can't touch my foot, the top of my foot, with my hand. If anything touches it, or even if the water drops on it, it's so painful. And I can't walk very far because of it, and my foot swells up a lot. And I just don't know what to do about it.
Well, what you just mentioned, first of all, it is a complicated question to answer, but it does have an explanation. This occurs after a trauma. It doesn't necessarily have to be due to a surgery, like in your case. And I don't think it's because they cut the wrong nerves. It's usually a response of our organism, and mostly in the joints. And what we call this problem is reflex sympathetic dystrophy. As you mentioned before, normally occurs after surgery or after an injury, and our nerves really become all screwed up, meaning that instead of giving you relief of the pain, it will increase the pain, it will increase the sensitivity, it will continue with swelling on the ankle. And the problem here is not that you have it, but how we're going to treat this. It is a complex problem, and it comes in different varieties. But in general, and this is something that obviously has to be evaluated in the office, normally we treat this with aggressive physical therapy. We give medication for inflammation. Sometimes when the pain or when the problem is chronic, we even do specific injections on the nerves, what we call a nerve block, from the ankle, from the knee, or from the back. It is a difficult problem. It does have a solution, but I think it needs to be addressed in a very careful manner. I hope that answers your question.
The next exercise Joe is demonstrating to straighten up the shoulders is called forward raises. Now the key to this is to take it in moderation and to have a firm stance, knees slightly bent, and we're gonna go ahead and isolate each shoulder so we can go ahead and strengthen each shoulder properly. Now the key to this as well is to keep the exercises, movements parallel.
Do you have a question for a doctor?
Yes. Doctor, my mother had a knee replacement surgery like 6 months ago, but she still complains of pain. Is that normal?
Well, you just mentioned that your mother had a knee replacement. First of all, I think it will be nice for everybody to know what a knee replacement is, and I think that will help everybody. I have a model here just to show what a knee replacement is. A lot of people get scared with that concept of the knee replacement because people think that we cut the bone and then we put a new knee like a horse or something like that, but it's not. What we normally do, and I'm going to show you a model. This is a model of a knee replacement. This is a plastic model, but this is the real thing. This is the knee, and this is the thigh bone, this is the leg bone, and the knee moves this way, it moves this way, and in this particular case moves inside and outside. That's what we call a knee replacement. The only thing we do is we take the cartilage. As you can see here, this is the cartilage. We take it off with saws, and then we put the top part of the knee replacement and the back part, which consists of a plastic and a metal. That's what we call a knee replacement. We just replace the cartilage. We don't replace a bone part. If your mother continues to have pain after 6 months, sometimes I think just being patient will be the treatment here. That means just observation. But the knee replacement is a surgery that is very dependable surgery. 95% of the patients usually will relieve the symptoms. Like I tell my patients, nothing is 100%, but this type of surgery is very predictable. Most of the time we can relieve the pain, but also because she still has pain after 6 months could be to a variety of problems. The most common one is continue with inflammation. Sometimes our body reacts with a lot of inflammation around the joints. Sometimes could have just a very little bit of infection. But this particular problem has to be addressed with your doctor or with the orthopedic surgeon